Our goal is to bring you pertinent and engaging information about the health of you and your loved ones. So let's get started.
Hello everyone, it's Dr. McPherson with My Spine and Joint, and I'm here with Caitlin. And today we want to talk about some of the memberships and services we have at the practice to help you get the care that you need. So Caitlin, would you mind telling us a bit about the memberships?
Yeah, so we offer 3 different memberships. We have one that's $35 a month, and that includes an adjustment. Our other one is $40 a month, and that includes one adjustment and a 15-minute hydro massage. Our third option is a $55 a month, and that includes an adjustment and one therapy.
Wonderful. And so what I like about the membership plan is that it keeps you very compliant, and that first tier that we have is just one adjustment per month. So one adjustment per month here is typically out of pocket about $45, but if you're on the membership plan, it's $35. So right there you have a great savings. So it keeps you compliant, and it's an automatic draft that automatically comes out of your bank account. You don't have to worry about it, but it keeps us helps us to keep you on track, and it keeps you in great health on the way that you want to be. So, and that second plan you said was what again?
That one's $40 a month, and that includes one adjustment and one 15-minute hydro massage.
The hydro massage. So the hydro massage is great as well because it kind of pairs with the adjustment to give you a better result. So whether it's improving your circulation or helping you relax a little bit more, it's going to help you to have a more of a lasting impact of the adjustment. So I like that option as well, and people come in just for the hydro massage, and it's very popular here, and I think it just is a little icing on the cake of the adjustment to say, right? So yeah. Tell us about that third plan.
The third one is $55 a month, and that's one adjustment and one therapy.
Therapies. So the therapies are great, because a lot of people, aside from just the pain that they're experiencing, it's not necessarily just a spine condition. A lot of times it's a soft tissue or the muscles or whatever's in that local area. So the therapies, whether it be ultrasound therapy or heat or myofascial release or manual therapy, those will really help you to hold your adjustment a lot longer, get better results, and just feel better ultimately. So for me, it's great because obviously I want to do what's best for the patient to get them better, but the patient is great. They're able to get more bang for their buck, let's say, with the membership versus having to pay for those individually or a la carte. So those are the membership plans we have here, and like I said, I really like it because it's convenient, it's automatic. We can send you a text link on your phone, and you can sign up from your couch, or you can come in the office and we'll do it here right away. So no qualifications, no pre-approval or anything like that. It's just a matter of if you need it and it's beneficial for you, we'll get that set up for you.
Yes. So with the memberships, there is a one-time enrollment fee of $25.
Yeah, and the good thing about that too is it's paid at the first visit. You just get it out the way. It's a one-time thing. It's not annual either. It's just a one-time thing. But if you ever needed to terminate that, like let's say you had to move, or you're a snowbird and you just weren't going to be coming back for a while, you could always cancel that with 30 days notice and just let us know in writing, or we'll just document it, but let us know. We can cancel that at any time. Another thing I wanted to make sure we talked about was eligibility. So the only patients who may not qualify for this would be a Medicare patient. So Medicare, unfortunately, they have a ton of rules, and sometimes this can present an issue for Medicare, not only within chiropractic, but this direct primary care model is popular throughout medicine, and Medicare the rules apply across the board. And if you are a Medicare patient, unfortunately, you can't enroll in this type of arrangement with us for the chiropractic, but you can for some of our other services. Like say you wanted to create a membership package for us, if you just wanted to do some ultrasound and some manual therapy because you found benefit with that, we could create something for you with that. So that's one thing, but that's the only thing. The membership for Medicare patients won't apply, unfortunately.
Get to know the trusted leader for chiropractic, sports injury, and auto injury care in Pinellas County. Dr. Michael McPherson of My Spine and Joint is the choice of your community. With state-of-the-art equipment, great access from many main roadways, and a warm, welcoming environment, it's easy to see why many choose My Spine and Joint for their injury and health needs. Known for thorough and compassionate care, Dr. McPherson takes pride in helping patients of all ages realize their health goals.
All right, so there are a lot of popular videos or viral videos and things like that on YouTube or across the web about chiropractic, and I think it's great because it's at least bringing up a conversation around chiropractic and treatment. But I always caution our patients not to get too caught up in what they see on those videos, because it can be a little scary and a little alarming, especially if you've never had chiropractic care before. So that's one of the reasons we do some of these videos that we're doing in office and that we're getting ready to do, is to better educate people on what to expect and what's good medicine versus, just people trying things out to get likes and clicks, So I would say continue to broaden your horizon as far as exposing yourself to different things that's out there, but don't get too influenced by some of the things you see on YouTube or on the web about what to experience when you come in here, because you can go into 5 different offices and have a different experience, and just know here that everything that we're doing is always going to be in the best interest of the patient, and we're not doing anything experimental. Everything that we're doing is always going to be very well supported. So. Okay, Caitlin, so we recently had a patient that came in that saw something that we did on Facebook regarding our laser and nerve pain and neuropathy, and I want to really talk about it because it can be really life-changing for people. We always talk about it, in between patients, that nerve pain is one of those things that people struggle with, and it really affects you every day to day, but it's hard to really find something that really works for that. And fortunately, we have our cold laser now, and it's been phenomenal for a lot of things that we use it for, pain relief and things like that, but also for nerve growth and nerve regeneration. It's very powerful, and it's one of those things too where the technology has been around for a while, but it's really, the research is starting to catch up to some of our in practice anecdotal type of findings, where we may see results in the office, but you don't see the research really to kind of has been there to support that. But within the last 5 to 10 years, it's there now, and that's really good and encouraging for the patients too, because sometimes you, like I said, have tried so many other things, and you kind of lose hope a little bit, but the fact that now you're having some substantial results and having some research to back that up is pretty good for the patient. So we usually see it for like our diabetic patients. So with diabetes, anybody suffering from that for a long time, they'll tell you they have numbness and tingling and different types of neuropathy throughout both feet or one foot. And you can also get diabetic ulcers, which can be a series of events leading to infection and maybe even amputation, unfortunately. So we have the laser now that will allow you to be able not only get the pain relief, but also prevent you from possibly having some of those complications from diabetes and maybe like an amputation or something like that. So whether it's a new infection or a new diagnosis or new symptoms, or even it's something you're dealing with for maybe 2 years or more, just call us and we'll have a consultation and talk about that and see if it's a good application for what you're dealing with, because I would love for somebody to at least make that recommendation for me if I had something like that going on, versus having no hope whatsoever. So we'll always be completely honest with you and go over your records and see if it's a good option for you. So the laser is something that I'm happy about, and I'm glad that our patients are starting to see that, our community is starting to be aware of that, and hopefully we can get that message out a little bit more and help people with that nerve pain and neuropathy.
Tired of those useless tummy teas? My MediSpas has your solution. Our exclusive body contouring medical laser is a pain-free procedure specifically designed to destroy fat cells instantly. Body fat and cellulite don't stand a chance. Lose inches rapidly with quick results during our comfortable and painless sessions.
Now I can feel and look my best without having to worry about stubborn belly fat.
Visit mymedispas.com today to receive a free consultation and more information. Results may vary.
Okay, so here during the summertime, it's an active time of the year. We're all out having fun, doing a lot of things and taking vacations, and I have a lot of seminars and things to attend as well, but a lot of our patients are also traveling too. So we do change our hours during the summer, and you want to tell us a little bit what we're doing this summer?
Yeah, so for the summer hours, we're going to do Mondays, Wednesdays, and Thursdays from 9 to 6 with a lunch break from 12 to 2. And then on Tuesdays, we're doing 9 to 1, and Fridays, we're closed.
Yeah, and that gives us some flexibility, and it also gives the patients enough time to come in as needed. If there's ever like a real emergency or something, our text line has been very popular. Patients really like that, so just our main number, 727-475-2608. You can text us and we can probably try to shuffle something around for you, but for the summer, it's just a little bit better for us and the patients to just change the hours a little bit, but we'll be back in the fall to our normal hours.
Pain and injuries can happen unexpectedly. When it happens to you, it can be overwhelming, but know where you can turn for help. My Spine and Joint is the solution you can turn to for everything you're going through. Ask for us or call us directly at 475-2600.
That's all for our show today, and remember, always seek emergency medical care first if needed. But if you feel one of your loved ones or yourself may benefit from our services, please feel free to call or text us at 727-475-2608. We'll see you next time.